One of the things that separates the CK Hui Heart Centre from many other institutions is our culture. A culture that believes in getting things done for the patient. And that's something I'm very proud of.
We are all working together for the benefit of our patients.
Between our physicians, our residents, all of our staff, they're just a really amazing group of people.
No matter how sick the patient is, there's always going to be somebody there to help you. The support here is amazing.
I would have been gone a long time ago without the Hui Clinic. If they can help others in my position, that's great.
The CK Hui Heart Centre opened just a little over 5 years ago, and since we've consolidated into a single floor in a single area, our quality of service and our efficiency of service has improved dramatically.
A typical day on this unit, we have rounds every day, twice a day. We're a teaching hospital, so we always have residents. We have visiting residents from out of country. We can have a moment where we don't have too many patients, and then it's rushing a patient to stabilize them here. It's rushing them to the cath lab to be able to do life-saving procedures and discuss that patient, see who's coming and what can we do to change their life around immediately.
Okay, because we're going to put a stent there too.
So the biggest motivation for coming to work every day is colleagues. We're such a great team here. Everybody pitches in and helps out. I've literally seen miracles happen where a patient who shouldn't survive does survive, and being part of that is amazing.
The CK Hui Heart Centre depends heavily on outside support from donors, primarily through the Royal Hospital Foundation. We've benefited dramatically from support, and the services and programs we offer would not be possible without some supplemental funding.
I was playing hockey in Reno, and one of my teammates and I were warming up before the game, and I said to Bob, my chest is tight. So I wound up with Dr. Huey's care and wound up with an angiogram and an angioplasty at the same sitting. We are happy to support the Hui Clinic because we owe them so much. For me, it's the only way I can say thank you, because I wouldn't be here today without that treatment that day.
We're going to put our catheters up there and then we'll start taking some dye pictures, okay?
Donor support is very important for us because anything over and above our regular services, we have to look for funding. The outreach programs, education programs are important because prevention is always better than cure.
Perhaps one of the most important initiatives that the CK Hui Hospital has done is to reach out to the multicultural communities. In the South Asian community, they have a prevalence of heart disease that is 3 to 4 times higher than people of Caucasian background. But then we talk about genes loading the gun, but the environment pulling the trigger. Well, these folks are genetically predisposed to heart disease, so there's a lot of work that needs to be done.
Hit your hip forward. Good. I was contacted by someone from the CK Hui Heart Centre to do a Bollywood aerobics class, which is a Bollywood dance fitness class, to reach out to the South Asian community. 1, 2, 3, 4. My origin is from India, and I don't know a single family within my own network that hasn't been touched by heart disease or diabetes. I have a 3-month-old daughter, and I want her to see me taking care of myself so that she has a good role model, so that she will take care of herself as well.
I think it's essential that the CK Hui Heart Centre can count on continued support from our foundation to allow our program to grow, to allow our quality of healthcare to continue to improve, and to supply state-of-the-art cardiac care to our patients.
Thank you, room 11.
All of us are going to know somebody that is going to need assistance with this, and we have to know that we are providing the absolute best care for them.
Supporting the CK Hui Heart Centre not only supports our patients, but it supports cardiac research that's ongoing that benefits all of Canada.
I certainly hope that they will continue to grow and be a leader in the care of cardiac patients in Canada.